The Prime Minister Najib Razak has launched the mission to build and facilitate the failed hospital at Cox Bazar, Bangladesh. The mission of this failed hospital is to reduce the suffering of Rohingya refugees that are stranded at the border of Bangladesh by supplying medical aid to them. 139 well-trained specialists, including specialized doctors, medical officers, and support workers from the Ministry of Health and NGOs will be sent for this mission.
The problem is so huge. There's a lot of maternal and children issues that need to be addressed. So if we can and then there's only 2 field hospital there, so that's not enough to cater about 1 million population. So I went to visit MSF and the Red Crescent Hospital, which is situated in the Kutub Palong base camp. They are actually overworked and they cannot cater all the problematic cases. So I think this field hospital initiated by the government of Malaysia is a very good idea, a very good move to help lessen the burden of 2 currently the 2 existing hospitals now in Kutub Palong area.
This failed hospital that Malaysia is going to set up in Bangladesh is for babies and children health.
I'm one of the doctors who is going for the mission to Cox Bazar, Bangladesh. I was working with Mercy before in Pakistan 2006. That was my first experience in obstetrics and gynecology at the disaster field. I'm volunteer myself to the Ministry of Health to give service to help refugees from Rohingya in Cox Bazar, Bangladesh. My work is basically dealing with the obstetric cases and gynecology cases. What I heard from what I read from my reading and from the news, there are lots of obstetric cases, pregnant mothers who are poor in terms of obstetric care.
My mission is to continue the care of the pregnant mother, because I'm an ONG specialist, to help the delivery, to safeguard the safety of the mothers in the refugee, and also to ensure they will have a smooth delivery and uncomplicated delivery with a good outcome for the mother and the baby.
The hospital caters 50 to 100 beds, operation theatre, and intensive care units, besides X-ray and research facilities. The Prime Minister Najib Razak said the hospital will be built by the Malaysian Armed Forces and managed by the Ministry of Health and volunteers. This is a joint effort and manifestation of the Malaysian government and people to help the Rohingya refugees who are being discriminated badly.
We are going to provide our service for about 2 weeks because as a specialist, all of us have our core business in Malaysia, so we cannot leave our hospital for long, but we will make sure that every 2 weeks there will be specialists who is going to provide the obstetric and gynecology services there. So I understand that the services of maternity, delivery and gynecology is very insufficient over there. So we are going to set up a field hospital which is going to be a referral center. So I understand that Mercy is having the labour and delivery suites over there. So if they have problems, they are going to refer to us to perform a cesarean sections. We are going to bring along our pediatric colleagues who is going to take care of the babies and the newborns.
For the last few months, Rohingya Muslim refugees has been stranded at the border of Bangladesh fleeing from Myanmar, and many of them have been injured very seriously, but there are not enough hospitals to resort to for medical care. Malaysia will set up a field hospital for them in Bangladesh and will send a range of medical experts.